evening everyone. So in today's class we will be discussing about the comparative anatomy of anterior teeth. Right, so in today's class we will be discussing about the anterior teeth and comparing these teeth with each other. So first let's begin with their origin, right? How do they develop? So as you know, their development is from lobes. So lobes are the primary developmental center for the teeth. And when we are comparing these anterior teeth, let's first talk about these lobes. So as we know, we have studied in one of the previous classes that minimum number of lobes required to form a tooth is 4. But in primary incisors, it is considered that these primary incisors are made up of just one lobe. Though this is an old concept, yet as far as your MCQs are concerned, if you have an option which says one lobe, then you will mark it, right? So if there is a question that how many lobes make up a primary incisors, and if the option one lobe is present, then you will go with it. If one lobe is not there and 4 lobes are present, only then you will mark 4 lobes, right? Whereas permanent incisors and canines, both primary and permanent, are made up of 4 lobes, right? So this is the first comparison as far as these anteriors are concerned. Their lobes, the number of lobes from which they are made up of. So when we are comparing these teeth, let's compare them based on their characters, right? So let's compare the elevations and depressions on the surface of these teeth, right? So that would be easier for you to remember. Let's first go to the elevations, the different elevations that are found on this tooth, that are found on these teeth, right? So let's first start with the elevations. Now when we say elevations, any prominence on the surface of the crown or on the root can be grouped under elevations, and any depression, right, can be grouped under depression. For example, pits, fissures, grooves, all those are depressions. As far as elevations are concerned, mamelons, cingulum, marginal ridges, all those are elevations. So let's first begin with the elevations. Now we have already covered one prominence, and that is lobe, right? Second that we're going to talk about is mamelons. Second is mamelons. So when you talk about mamelons, what are mamelons? Now when you look at a newly erupted incisor, what you would notice is that its incisal ridge has these scalloped elevations, isn't it? The incisal ridge has these scalloped elevations, and these elevations on a newly erupted tooth are known as mamelons, right? These are mamelons. And what do these mamelons represent? These represent the facial lobes, right? So 3 facial lobes or 3 lobes make up the facial surface of these incisors, and that's why we have 3 mamelons. The 4th lobe will make the lingual surface, or you can say the cingulum. So the cingulum is made up of just 1 lobe, whereas the facial surface or the labial surface is made up of 3 lobes. Now sometimes they might ask you which of these mamelons is the largest mamelon or which is the smallest mamelon. So as far as the maxillary central incisor goes, usually these mamelons are of the same size. So usually mamelons are of similar size. So there is hardly any difference. But when it comes to maxillary central incisor, now when we talk about a tooth and we do not specify whether it is a primary or a permanent, we will consider it as a permanent tooth, right? Even in your MCQs, even in your exams, if the tooth is not specified whether it is a primary or a permanent, we will consider it a permanent tooth. So unless it's specified, it is a permanent tooth. So in case of maxillary central incisor, that is the permanent maxillary central incisor, the middle mamelon is the largest and the distal mamelon is the smallest, right? So the distal mamelon is smallest, the middle mamelon is the largest, and mesial mamelon is between these two. Apart from it, the remaining teeth, the remaining incisors, they have mamelons which are of more or less of equal size. So questions are not made there. Question is made on maxillary central incisor mamelons, right? So this was about the first elevation, that is mamelons. Next, we can go to the incisal ridge. So what is the difference between incisal ridge and incisal edge? So there is incisal ridge and there is incisal edge. So what is the difference between the two? A newly erupted tooth would have incisal ridge, which is rounded and which has not yet worn. But when this ridge undergoes attrition, right, when it wears away, after it wears away, the incisal ridge, it will become attrited, it will become sharp, and now it will be called incisal edge. After attrition of ridge. So obviously an incisal edge would lack mamelons, and these mamelons would be present on only incisal ridge, right? Now, when the incisal ridge is concerned, what differences can be there between the different anteriors? So in case of maxillary anteriors, the incisal ridge, it lies labial or on apex of the root, or you can say it lies labial to the bisector of the tooth. So let's say this is, so let's say from the proximal view, if this is your tooth, right, and if you draw a bisector, then this incisal edge will be either slightly labial to this bisector or on this bisector. In case of mandibular anteriors, the incisal edge, it lies lingual to the bisector. So incisal edge, or if it's newly erupted, it is ridge. So incisal edge or the incisal ridge lies lingual to the bisector. So that is one difference between the maxillary and mandibular anteriors, and it applies both to primary and permanent dentition. So incisal edge in primaries or in permanent, in maxillary, is labial to or on line with the bisector. In mandible, it is lingual to this bisector, right? So what would be the next elevation? We have talked about the incisal ridge, right? We can also talk about its orientation. So orientation of the incisal ridge. Usually in the central incisors, be it maxillary or be it mandibular, the incisal ridge is straight mesiodistally, right? Mesiodistally it is almost straight, but in case of laterals, the incisal ridge curves slightly distally. It has slight curve from mesial to distal. It curves right? So the incisal ridge has a curvature from mesial to distal. Also, it might have slight slope. So if you look at it from labial or lingual aspect, let's say this is the maxillary lateral incisor and this is the mandibular lateral incisor. So what you would notice is that from mesial to distal, it has slight slope, right? It slopes distally. So it slopes distally in a cervical direction. Also, it has a distal curvature when you look at it from the incisal view. So these are the incisal views. So from incisal view, you can see that there is a distal curvature, and from the facial or from the lingual view, you can also notice that this incisal ridge slopes lingually. So this feature is present in the lateral incisor, right? The curvature of the incisal ridge is present in the lateral incisor, whereas it is more or less straight in the central incisors. So be it primary or be it permanent, the incisal ridge would be straight in the centrals. So when you look at the centrals, the incisal ridge would appear almost straight. It would appear almost straight. So can you tell me which is the most symmetrical tooth? So when you say tooth, consider it as crown, right? Usually we compare the crown. So which is the most symmetrical tooth or which is the most symmetrical crown? And options are upper central, lower central, upper lateral and lower lateral. So which of these four do you think is the most symmetrical tooth? And the correct answer would be, it is the lower central, right? The lower central is the most symmetric tooth. You cannot easily make out whether it is the left or the right mandibular central incisor that easily, isn't it? So this is the most symmetrical tooth. So this was about the orientation of the incisal ridges, their angulation and their orientation as far as their alignment to the bisector, right? So next elevation we can go on to the labial ridge. So what is labial ridge? This labial ridge is exclusive to the canines. Labial ridge is an exclusive feature of canine. It is not found in incisors, right? It is not found in incisors. It is exclusive feature to canines, and in canines it runs cervicoincisally, right? So this is the labial ridge, and labial ridge runs cervicoincisally. So basically, it's labial ridge would be present on upper primary canine, upper permanent canine, lower primary canine, and lower permanent canine. So these four teeth will have this labial ridge, right? And if you are asked which tooth has the most prominent labial ridge, then upper three has the most prominent labial ridge, and least prominent labial ridge would be seen on lower deciduous canine. So this is the least prominent. Is it clear? So labial ridge is basically cervicoincisally running ridge, and it is most prominent on the maxillary permanent canine and least prominent on mandibular deciduous canine, right? What else? What other elevation can be seen on the labial surface, right? On the labial surface. So when you talk about the labial surface, the other prominent ridge can be cervical ridge. Now when we studied or when we discussed about the differences between primary and permanent teeth, there we discussed about the cervical ridge, isn't it? Cervical ridge is a horizontal ridge. Cervical ridge is a horizontal ridge and seen running at the cervical level, and it is a characteristic feature of primary dentition. So obviously when we are talking about anteriors, it will be seen on primary anteriors. It is not seen on permanent anteriors. So it is a feature of primary anteriors and it is absent in permanent anteriors. So that is one more difference between the primary and the permanent anteriors, right? And we also talked about the tooth where this cervical ridge is most prominent when we're discussing about the primary and permanent, and there I told you that it is most prominent on the first molars, first deciduous molars, and even in the first deciduous molars it is more prominent on the mandibular molar, on the mesiobuccal aspect, isn't it? So this is about the cervical ridge. Now if we talk about the labial surface on the whole, labial surface, right? If we talk about the labial surface, so do you think there is a difference between the lateral incisor and the central incisor and the canine? Do you think there is a difference? Now when you take a look at the central incisor, the central incisor labial surface appears almost straight, isn't it? Compare it to the lateral incisor. In case of lateral incisor, the labial surface is curved, and when you compare it to the canine, you would notice that the canine has the most prominent curvature. It has the most prominent curvature. Now the reason for this prominent curvature on canine is the labial ridge. Nonetheless, even when there is a lack of labial ridge on the incisors, the lateral incisor is more curved as compared to the central incisor. So as you can see, the labial surface of lateral incisor has more curvature, or it is more curved as compared to the central incisor, which is almost flat. So if I ask you, because of this curvature, the lingual features of the lateral incisor, do you think they will be more prominent as compared to the central incisor? So because of the curvature of lateral incisor labial surface, do you think that its lingual features will be more pronounced? Do you think its lingual features would be more pronounced as compared to the central incisor? Now obviously there is no question as far as the size is concerned. Central incisor is larger as compared to the lateral incisor, isn't it? Central incisor is larger than lateral incisor, isn't it? Central incisor is larger than lateral incisor, and canine is larger than either of these two teeth, right? Canine is larger than either of these two teeth, but here we are right now comparing these incisors with each other. So if I ask you, though the size is greater for central incisor, do you think the features would be more prominent in lateral incisor? Now when you say prominent, prominence does not imply size, right? It means just that they are more visible, isn't it? They are more visible. So let's talk about the lingual anatomy. So when we go to the lingual anatomy, let's say incisal. I just talked about incisal ridge, isn't it? Incisal ridge, it is straight in case of centrals, it slopes in case of laterals, and it is absent in case of canine, because there we have cusp ridge. In case of canine, we have cusp ridge instead of the incisal ridge. Yet if you take a look at the lingual surface, right? If you take a look at the lingual surface, there what all can we see? Let's say this is the lingual surface of an incisor, right? This is the lingual surface of an incisor. Here you have cingulum. These are the marginal ridges. Maybe let's say this is the mesial, and this is the distal marginal ridge, and this is the incisal ridge. So now when we compare the lingual anatomy, and this is the lingual fossa, right? This is the lingual fossa. These are the features that are seen on the lingual surface. When you compare these features, right? When you compare these features, let's compare all the three teeth, that is canine, central incisor and lateral incisor. Now in case of canine, so this is the canine, this is the canine. So in case of canine, we have a cusp ridge instead of incisal ridge. Then you have the lateral incisor and then the central incisor, right? So when you talk about the absolute size, central incisor is larger than lateral incisor and canine is larger than either of these two teeth. But now we are comparing the lingual surfaces of these teeth. So when you compare the lingual surfaces, what you notice immediately is that these two teeth have a single lingual fossa, but in canine the lingual fossa is divided, isn't it? It is divided. This is one and this is the second lingual fossa, and it is divided by a ridge which is seen here, isn't it? This ridge. What is this ridge called? It's called lingual ridge, and this lingual ridge is exclusively seen in canines. So when we talk about canines, it is more prominent in permanent as compared to primary, and it is more prominent in maxillary as compared to mandibular. So obviously it would be most prominent in maxillary permanent canine, right? This feature is most prominent in maxillary permanent canine, and this lingual ridge would divide. It would divide the lingual fossa into mesial and distal lingual fossa, isn't it? So which is the mesial lingual fossa and which is the distal lingual fossa? This is the mesial and this is the distal lingual fossa, right? Now you might argue, how do I know which is mesial and which is distal? So you can take a look at these cusp ridges, the size of these cusp ridges, that gives us a hint, and I'll come to it later on. But right now, let's just talk about the lingual anatomy, right? So, as I told you, the curvature of the labial surface is most prominent in canine, then lateral incisor, and least in central incisor. So, all the features would be most prominent in canine, followed by lateral incisor, followed by central incisors, isn't it? So, let's say we are talking about cingulum, isn't it? Let's say we are talking about cingulum. So cingulum would follow the same order. This is the prominence, isn't it? We are not talking about the size, just the prominence. Where is it most prominent? It is most prominent in canine and least prominent in central incisor. But when we are talking about the size, it would be canine, then central, and then lateral. So though the canine, though the lateral incisor has a smaller cingulum, it is more prominent than that of central incisor in the maxilla. But when we talk about the mandible, right? When we talk about the mandible, so in the mandible, again canine has more prominent cingulum, then the lateral incisor, and then central incisor has the least prominent. And this would be the same sequence for size. Now why is that so? Because in case of mandible, the lateral incisor is larger than the central incisor, isn't it? In case of maxilla, it is the central incisor which is larger, but in case of mandible, it is the lateral incisor which is larger, right? So what you can note here is that in maxilla, central incisor is larger than lateral incisor, but in case of mandible, lateral incisor is larger than central incisor, and this applies to both primary and permanent dentition, isn't it? It applies to both primary and permanent dentition, both primary and permanent. तो प्राइमरी में हम A larger than B कह देंगे maxilla में, और mandible में B larger than A कह देंगे. तो that you can do on your own, right? तो basic बात क्या है? Maxilla में central incisor is larger than lateral, and in mandible it is the lateral which is larger than central. So that is how you will decide which features will appear more prominent or which will have a greater size. So cingulum is larger in canine, followed by central, followed by lateral, as you can see here, isn't it? So these are both prominence and size in maxilla, and this is for mandible, right? So next, let's move to the next feature. Then the marginal ridges. Now, when we talk about the marginal ridges, there are two marginal ridges, isn't it? Let's go back to this diagram. There are two marginal ridges, isn't it? A mesial marginal ridge and the distal marginal ridge. The mesial and the distal, marginal ridge. So, on any individual tooth, the mesial marginal ridge is larger than the distal marginal ridge, right? So, on any tooth, the mesial marginal ridge is larger than distal marginal ridge, right? It is larger than the distal marginal ridge. Now, when you compare these teeth with each other, what you would notice is the sequence would be same. In maxilla, when you compare the size, it would be canine, followed by central, followed by lateral incisor. Same for mandible, it would be canine, followed by lateral, followed by central. Now, when we talk about prominence, again in maxilla it is canine, followed by lateral, followed by central, and the sequence is same in mandible, isn't it? So when you notice the sequence in marginal ridge and in lingual fossa, cingulum, that we just discussed here, isn't it? You would realize that these sequences are exactly same, isn't it? These sequences are exactly same. So whatever the lingual feature we are discussing, be it marginal ridge, be it incisal ridge, be it lingual fossa, be it cingulum, all these features will follow this same trend. There is no exception, right? All the features will follow this same trend. तो चाहे यहाँ marginal ridge लिखो, चाहे cingulum लिखो, चाहे incisal ridge लिखो, या और क्या बच गया, lingual fossa. So these are the features seen on the lingual surface, isn't it? तो आप इसमें से कुछ भी लिखो, जो sequence है that would remain the same, isn't it? The sequence would remain the same. Now, when we talk about the primary dentition, there would just be a slight change, right? वहाँ पर एक छोटा सा change है, बाकी सब कुछ same है. तो primary में जो छोटा सा change है वो क्या है? In case of primary dentition, maxillary central incisor has more prominent features than maxillary lateral incisors. So unlike permanent incisors, in the primary incisors, the central incisor has more prominent features than lateral incisor. तो यहाँ पर size भी central का ज़्यादा है, prominence भी central की ही ज़्यादा है. तो चाहे यहाँ size हो, चाहे prominence हो, in the primary dentition. So in primary dentition, be it size or prominence, right? Be it size or be it prominence, the sequence will always be C followed by A followed by B. In case of maxilla, ये तो maxilla में हो गया. यहीं अगर हम mandible की बात करें, तो in case of mandible, it would be C followed by B followed by A. So this would be the universal sequence for all the lingual features. Be it cingulum, be it marginal ridges, be it incisal ridge, be it lingual fossa, सब में यही same sequence है, कोई change नहीं है, right? Is it clear? Do you have any doubts? Do you have any doubts so far? तो प्राइमरी और परमानेंट में एकमात्र डिफरेंस क्या हुआ? difference सिर्फ है prominence of maxillary central incisors. In permanent maxillary incisors, it is the lateral that is more prominent, and in primary maxillary incisors, it is the central that is more prominent, right? अब हम आते हैं cusp ridge के ऊपर. मैंने आपसे कहा था कि वो बाद में डिस्कस करेंगे cusp ridge, right? So what is a cusp ridge? These are the two ridges which join to form the cusp, isn't it? So there would be a mesial cusp ridge and there would be a distal cusp ridge, and these two cusp ridges will join to form a cusp, isn't it? So in any tooth that has a cusp, there will be two cusp ridges. So canine bhi hai, right? Let's say this is the canine. This is the canine. So canine too has two cusp ridges, a distal cusp ridge and a mesial cusp ridge, isn't it? So again the question would be, which of these two cusp ridges is larger, or which of these two cusp ridges is longer? Is it the mesial cusp ridge or is it the distal cusp ridge? So जब हमने marginal ridges की बात की थी, which one was larger or which one was longer? The mesial marginal ridge is longer or larger as compared to the distal marginal ridge. But in case of cusp ridge, it is reverse, right? So in case of cusp ridge, the distal cusp ridge is longer than the mesial cusp ridge, right? The distal cusp ridge is longer than the mesial cusp ridge. Even here you can see it, that the distal cusp ridge is longer than the mesial cusp ridge, right? The only exception to this rule, is maxillary deciduous canine as far as the anteriors are concerned. Also, the maxillary first premolar is an exception. There too, the mesial cusp ridge is longer than the distal cusp ridge. So these are the only two teeth where mesial cusp ridge is longer than the distal cusp ridge, right? So in these two teeth, mesial cusp ridge is longer than the distal cusp ridge. Apart from these two teeth, in all other teeth, the distal cusp ridge is longer, right? I hope it's clear. So distal cusp ridge is longer than the mesial cusp ridge, right? And there are no exceptions apart from maxillary deciduous canine and maxillary first premolar. So this was about the elevations. Depression भी हमने बात किया, lingual fossa की हमने बात की. So depressions में I'll just enumerate once again. So as far as the anteriors are concerned, there are not many depressions, right? There are not many depressions on the crown. On the ground, we just have the lingual fossa, right? And I have already told you the comparative sizes of these lingual fossa in case of permanent and in case of primary both, right? Elevations also we have talked about. Now there is an exceptional elevation that is found exclusively on the lateral incisor. Sometimes it might be called tubercle, or sometimes, or some authors also call it accessory cusp. Sometimes it's called an accessory cusp, or sometimes it is called a tubercle. An example of tubercle or accessory cusp in case of anteriors is talons cusp. And as I just told you, talons cusp is found most commonly on the maxillary lateral incisor. So this is an accessory cusp or a tubercle, which is a feature of the maxillary lateral incisor. Similarly, we also have one more depression in case of maxillary lateral incisor, which is exclusive to maxillary lateral incisor. So what is that depression which is exclusive to maxillary lateral incisor? Palato radicular groove. So what is the palato-radicular groove? Let's say this is the maxillary lateral incisor, this is the root. Here you have the cingulum. So on the mesial side of the cingulum, sometimes a groove is seen going towards the root. So this groove is known as this palato-radicular groove, right? Palato-radicular groove or palato-gingival groove, and it makes cleaning difficult, isn't it? Sometimes it might lead to gingivitis or periodontitis, right? So benefit कोई नहीं है, नुकसान ही नुकसान है इसका. Palatoradicular groove, a depression which is exclusive to maxillolateral incisor and also an accessory cusp, a talus cusp, which is often seen in the maxillary lateral incisor, right? So this was about the elevations and depressions. Now let's go to their comparative sizes and shape. So how would you classify the shape of the anteriors? Can we say that all anteriors are trapezoid from facial or lingual view? So when you look at these anteriors from the facial or from the lingual view, they all appear trapezoid. So let's say this is a primary or prominent mandibular incisor, and don't you think it appears trapezoidal? It has 4 sides, 2 equal and 2 unequal sides. So these are the unequal sides. The larger side is towards the incisal edge and the smaller side is towards the gingival margin, isn't it? So it appears like a trapezoid. But if we talk specifically about the canine, right? If we are talking specifically about the canine, then how does the canine appear? Canine would appear like a 5-sided structure, isn't it? So we can say that it appears pentagonal, isn't it? It appears pentagonal. So the only pentagonal tooth in a deciduous dentition is, which is the only tooth in the deciduous dentition that has a pentagonal outline? In deciduous dentition, to have a pentagonal labial or lingual outline, and the answer would be canine. But in case of permanent, it is not just the canine, even the premolars have a pentagonal outline, right? So in case of deciduous, it is exclusively canine, but in case of permanent, anteriors में canine, posteriors में premolars, right? So from facial or lingual, they, अगर आप as a class consider कर रहे हो anteriors, then trapezoid is fine. If you are specifically talking about canine, then pentagonal is better. So if the question is labial outline of anterior teeth, right? And the options are, let's say, pentagonal, trapezoid, square, none. Then we'll go with trapezoid, right? Because the characteristic feature of the anteriors, all the anteriors, because there are more incisors, right? So we will say that it is trapezoid. But if this question is exclusively about canines rather than being about anteriors, if this question is about canines, labial outline of canine, then the answer would be pentagonal, right? So based on the question, your option will change, isn't it? So if it is about just canine, then you will say pentagonal. If it's about anteriors, then you will say trapezoid. So how would you define its shape from the proximal aspect? From the proximal aspect, so be it maxillary or mandibular, isn't it? Be it maxillary or mandibular, the shape can be described as wedge shaped, right? It could be described as wedge shaped. So wedge shaped is better as compared to triangular, right? तो अगर triangular और wedge, वैसे तो दोनों ऑप्शंस एक साथ नहीं आते हैं, अगर आ जाएं तो you will go with wedge shape, right? So wedge shape is better as compared to the triangular shape. Clear? So this was about the shape of the anteriors. Shape of the anteriors. Next, we can talk about positioning of cingulum. Sometimes question may be asked on the position of the cingulum. Now, position of the cingulum, basically mesiodistal and cervicoincisal, right? It can be discussed under cervicoincisal and mesiodistal positioning. So, अगर हम mesiodistal positioning की बात करें, it could be either mesiodistally centered or slightly distally displaced, right? Either it could be slightly displaced or it could be in the center. Now we have already established that the mandibular central incisor is symmetric. It is the most symmetrical, isn't it? So obviously mandibular central incisor is one tooth where mesiodistally the cingulum is centered. It is centered mesiodistally. So 3 teeth, maxilla and mandible included, will have centered cingulum and 3 will have a distally displaced cingulum. So lower one and upper 3 will have a centered cingulum. So the remaining 3 teeth, that is upper central and lower lateral and canine, will have distally displaced cingulum, right? And this applies both to primary and permanent dentition. Now, when the cervicoincisal positioning is concerned, there we will compare the primary with the permanent, right? Cervicoincisal positioning. So, when we say cervicoincisal positioning, usually the cingulum is within cervical third in permanent dentition, but it occupies entire cervical third in primary dentition, right? So when you look at the primary and permanent side by side, what you would notice is this is the permanent and this is the primary. So what you would notice is that the cingulum occupies the entire cervical third, whereas in case of permanent, it is within the cervical third, right? So comparatively, the cingulum in primaries appears larger as compared to the permanent. So in case of primary, the cingulum appears relatively larger than the permanent, right? Cingulum is relatively larger in primary as compared to the permanent dentition. Now let's go to the different sizes or dimensions. So when you talk about dimension, first is crown length. So in case of crown length, maximum crown length is of lower canine and it's approximately 11 millimeters. This is followed by maxillary central incisor approximately 10.5 millimeters, followed by maxillary canine which is 10 millimeters. Least would be mandibular central incisor approximately 9 millimeters होती है, right? तो least किसकी होगी? Mandibular central incisor, maximum mandibular canine, right? In case of primaries, this is permanent. In case of primaries, maximum crown length would be of maxillary central incisor and it is somewhere around 6.5 millimeters, right? So maximum तो हो गई upper canine की और minimum mandibular, sorry, I should not write 3, it should be C, और मिनिमम हो गई मैंडिबुलर लैटरल इंसाइजर की. यस, सो लैटरल इंसाइजर की लेंथ जो है क्राउन लेंथ दैट इज लेस एज कंपेयर टू द सेंट्रल इंसाइजर, राइट. तो क्राउन लेंथ में ये कुछ एक एक्सेप्शन है जो कि हम याद रख सकते हैं. तो इनके ऊपर कभी कभी क्वेश्चन पूछ सकते हैं आपसे, राइट. पर अगर इसी को हम कंपेयर करें विद द रूट लेंथ, व्हेन यू कंपेयर दिस टू रूट लेंथ, compare this to root length, तो क्राउन लेंथ तो मैक्सिमम थी मैंडिबुलर कनाइन की, बट रूट लेंथ मैक्सिमम है maxillary canine की, and it is somewhere around 17 millimeters. In case of mandibular canine it is 16 millimeters, right, and least or minimum would be that of mandibular central incisors. So this is for the permanent. अगर हम प्राइमरी में देखें, इन केस ऑफ प्राइमरी मैक्सिमम इज अगेन maxillary canine and minimum is again sorry, not again, but it is in mandibular central incisor, right. So if I ask you which tooth has maximum overall incisor or apico-incisor length, which tooth has maximum length, so let's say crown and root included, which tooth has maximum length? So which tooth has maximum length? Here the answer would be maxillary canine followed by mandibular canine. Now obviously when you calculate the crown length and the root length, you would get 27 millimeters for both, right. Mandibular canine has 11 millimeters of crown length and 16 millimeters of root length, so it is 27, and same is for maxilla, 10 plus 17, 27, but then it is fractionally larger as compared to the mandibular canine, right. So we have ruled out that fraction, and that's why we just write the whole numbers, and that's why it appears as if they both have same length, but it is not so. The maxillary canine has a larger or a longer or a greater length as compared to the mandibular canine, right. It has greater length as compared to the mandibular canine, and the mandibular central incisor is the shortest tooth. Mandibular central incisor is the shortest anterior tooth. It is not the shortest tooth in the dentition, it is just the shortest anterior tooth. But the mandibular central incisor is the smallest tooth. Now here I have not written anterior because it is the smallest tooth in the overall dentition. It is shortest anterior tooth, but it is smallest tooth, right. तो इसमें डिफरेंस क्या है, केवल एंटीरियर्स में ये शॉर्ट है, तो इससे भी और छोटे टीथ हैं. अगर आप थर्ड मोलर कंपेयर करने लगेंगे तो पता चलेगा थर्ड मोलर की लेंथ इससे भी कम है, राइट. सो सिंस वी आर टॉकिंग अबाउट द एंटीरियर्स, वी आर नॉट टॉकिंग अबाउट द थर्ड मोलर, तो इसलिए हमने कहा कि ये एंटीरियर्स में सबसे छोटा है, बट ओवरऑल अगर हम साइज की बात करें तो उसका साइज सबसे कम है अमंगस्ट ऑल द टीथ इन द डेंटिशन. क्लियर? बी इट प्राइमरी, बी इट एंटीरियर और पोस्टीरियर, इट इज द स्मॉलेस्ट टूथ. तो ये हमने क्राउन लेंथ की बात की, रूट लेंथ की बात की. अब मेसोडिस्टल डायमेंशंस. Mesodistal dimensions. So as far as the anteriors are concerned, so in anteriors, cervico-incisal length is always greater than mesodistal dimension, right. Mesodistal width, you can say. So mesodistal width is always less than cervico-incisal length. Exception क्या है इसका? So there is only one exception. There is only one exception, and that is deciduous maxillary central incisor. In case of deciduous maxillary central incisor, the mesodistal width is greater than the cervico-incisal length. So this is the only anterior tooth where the mesodistal width is greater than the cervico-incisal crown length, right? तो ये चीज हमें ध्यान रखनी है, because sometimes question may be asked on this, right? So apart from this, which tooth will have greatest mesodistal dimension? Obviously canine is the largest tooth. So canine followed by central incisor followed by lateral incisor in case of maxilla. In case of mandible, again it would be canine followed by lateral incisor followed by central incisor. तो ये चाहे साइज की हो बात, चाहे प्रोमिनेंस की हो, फीचर्स की अगर हम बात करें, जो सीक्वेंस है इट इज मोर और लेस सेम. तो हमने देखा था कि हमने चाहे मार्जिनल रिज की बात की हो, इंसाइजल रिज की बात की हो, लिंगुअल फॉसा की बात की हो, और यहाँ अब हम साइज पे भी आ गए हैं. तो इट इज मोर और लेस सेम सीक्वेंस, राइट. द सीक्वेंस इज द सेम. तो इसमें ज्यादा हमें कुछ याद करने की जरूरत नहीं है. अगर आपको एक बार ये समझ में आ गया कि canine is the largest tooth amongst all the anteriors, followed by the maxillary central incisor, followed by maxillary lateral incisor, and in case of mandible, again canine is the largest tooth, followed by lateral, followed by central. तो आप सीक्वेंस अपने आप भी यही लिख सकते हो, राइट. तो मीजियल डिस्टल बिट की बात हो गई. सिमिलरली अगर आप लेबियोलिंगुअल की भी बात करोगे, अगेन द सीक्वेंस वुड बी सेम. अगेन द सीक्वेंस वुड बी same both for maxilla and for mandible. In case of maxilla, central incisor is larger than the lateral incisor. In case of mandible, the lateral incisor is larger than the central incisor. So sequence does not change, it remains the same, right. अब हम रूट पे चलते हैं. ये हमने डायमेंशंस की बात कर ली, क्राउन की बात करी, अभी हम रूट की बात कर लेते. तो when we go to the root, there are some things that we consider in the root: its size, its length, its bend, and the developmental depression on the root, right. तो पहले साइज से बात कर लेते हैं. फर्स्ट इज साइज. So which tooth or which is the largest root amongst the anteriors? Now we are just focusing on the anteriors. So amongst the anteriors, which tooth has the largest root? It is the maxillary canine which has the largest root. Even if we are talking about posteriors, अगर हमें posteriors को भी include कर लें और हम आपसे ये सवाल करें, which is the largest root, right? And the options are, let's say, upper 3, lower 3, upper 6, palatal root, lower 6, mesial root, right? Then which of these would you choose as the answer? Is it upper 3, is it lower 3, is it upper 6 palatal, or is it lower 6 mesial root? Which of these is the largest root? अभी हमने इस क्वेश्चन के लिए एंटीरियर पोस्चर सबको कंसीडर कर लिया, राइट. और हमें जानना है कि which is the largest root in the dentition. तो डेंटिशन में, in the entire dentition, which root is the largest? तो इसका आंसर क्या होगा? इसका आंसर भी maxillary canine ही होगा, right? It is the maxillary canine which has the largest root. It is the maxillary canine which has the largest cusp amongst all the cusps in the entire dentition. तो पूरा dentition consider कर लोगे तो भी maxillary canine, permanent canine जो है, it has the largest cusp, it has the largest root, right? Also it has the longest root in the entire dentition. So largest कहो, longest कहो, आंसर सेम ही आएगा इस क्वेश्चन में. Is it clear? तो ये साइज, अब साइज में स्मॉलेस्ट किसका होगा? So which tooth has the smallest root? Again we will follow the same sequence, isn't it? Maxillary and mandibular, maxillary teeth are larger than mandibular teeth, isn't it? Maxillary teeth are usually larger than mandibular teeth. Also canine is larger than incisors. In case of incisors, and in case of incisors, in the maxilla, central incisor is larger than lateral incisor, and in case of mandible, the lateral incisor is larger than central incisor. तो ये सिंपल सा कंपैरिजन है. ये अगर आप याद रखोगे तो सारे फीचर्स आपको याद रहेंगे, किसमें प्रोमिनेंट है, किसमें लेस प्रोमिनेंट है, राइट. तो maxilla has more prominent features as compared to mandible. Canines have more prominent features as compared to incisors, and in maxilla it is the central incisor which has more prominent features as compared to lateral. Sorry, not prominent but larger, right? Central incisor is larger than lateral, and in mandible it is the lateral which is larger than central. तो रूट की भी अगर हम बात करें, so which is the smallest root? हमने कहा कि largest root तो है maxillary कनाइन की, तो स्मॉलेस्ट रूट किसकी होगी? मैंडिबुलर सेंट्रल इंसाइजर, राइट? सो स्मॉलेस्ट रूट इज दैट ऑफ मैंडिबुलर सेंट्रल इंसाइजर. दिस इज द स्मॉलेस्ट रूट. लेंथ की हमने ऑलरेडी बात कर ली है. जब हम क्राउन लेंथ की बात कर रहे थे वही हमने रूट लेंथ की भी बात कर ली थी. मैक्सिलरी कैनाइन हैज मैक्सिमम रूट लेंथ एंड मैंडिबुलर सेंट्रल इंसाइजर हैज लीस्ट रूट लेंथ, राइट? सो दिस वुड बी सेम फॉर बोथ प्राइमरी एंड परमानेंट. उसके बाद हम बेंड की बात करते हैं. सो वेयर डज द रूट बेंड? रूट्स यूजुअली bend in distal direction, right? So let's say this is the root and at the apex it might show a slight distal bend. बहुत ही गंदी रूट बन गई है, right? It might show a slight distal bend. So this is the general rule that the roots might show a distal bend. अब सेंट्रल इंसाइजर्स जो हैं, सेंट्रल इंसाइजर्स यूजुअली हैव अ स्ट्रेट रूट, मोर सो इन मैक्सिला एज कंपेयर्ड टू मैंडिबल. सो मैक्सिलरी सेंट्रल इंसाइजर हैज एब्सोल्युटली स्ट्रेट रूट. आपने ओएस में भी पढ़ा होगा ओरल सर्जरी में दैट दिस इज द ओनली टूथ दैट यू कैन एक्सट्रैक्ट विद द रोटेशन मोशन, isn't it? With a rotational motion, right? Apart from that, all other tooth they have to be extracted in a buccolingual direction, right? But maxillary central incisor, it can be extracted with a rotational motion. Why? Because its root is almost straight, isn't it? It does not have any bend. But lateral incisors or canines, they will show a distal bend of their root. In case of primaries, they do have a distal bend. But apart from the distal bend, they will also show a facial bend, isn't it? Apart from the distal bend, they will also show a facial bend. So let's say this is the primary tooth. Then in case of a primary tooth, what you will notice is that the apex, it is slightly bent facially. And how much is this bend? It bends by a 10-degree angle. तो अगर आप इस लॉन्ग एक्सिस को प्रोजेक्ट करें तो ये जो एंगल होगा विद द लॉन्ग एक्सिस, इट इज समवेयर अराउंड 10 degrees, right? So it bends by 10 degrees in the facial direction. And why does it bend facially apart from the distal bend? Because it needs to accommodate the developing successor, right? It needs to accommodate the developing successor. तो उस successor को accommodate करने के लिए जो apex है वो 10 डिग्री से facially bend हो जाता है. So this is a feature of deciduous anteriors. It is not seen in permanent anteriors, right? तो ये distal bend and facial bend. Next मैंने आपसे कहा था developmental depressions. Developmental depression. So what are developmental depressions? Let's say this is the root, this is the mesial side, and let's say this is the distal side. So both on the mesial and distal side, sometimes depressions are seen, right? Sometimes depressions are seen on the root. Let's say this is the mesial surface. So on the mesial surface, let's say like this, a depression would be seen, and these depressions on the root are known as developmental depressions. Clear? And these developmental depressions, they might be seen either on the mesial side or on the distal side, or maybe on the both sides, or maybe they will be absent, right? Usually on the anteriors. So usually on the anteriors, these depressions are on distal surface. So what it means is that the developmental depressions are more prominent on distal as compared to mesial. In all the anteriors, right? In all the anteriors, the distal developmental depression is more prominent than the mesial developmental depression. The exception is The exception is maxillary central and lateral incisor. So maxillary incisors are the exception. In case of maxillary central, usually these developmental depressions are absent, right? Usually these are absent, but if they are present, they will be on the mesial side. Similarly, for the lateral incisor, it is usually present on mesial, but it is absent on distal side, right? So these are some of the differences between the anteriors, comparison between the anteriors, right? Canines, incisors, primary, permanent, उन सब पे हमने कुछ features को लेके comparison किया, right? On which usually questions are asked. If you have any doubt, you can ask me now. अगर कोई भी डाउट है तो आप पूछ सकते हो. Do you have any doubts? So if there are no doubts, then we'll meet again in the next class. All the best.